morning, everybody. Welcome to our 7th Web Talk of 2021. Happy St. Patrick's Day. I am sorry for the delay this morning. I think there's some internet problems on my end of the webinar today. I'm Lydia Mitsoulides, the Executive Director for the Alliance for Leadership in Education, your host for these Web Talks, and I'm excited to say we have 402 people registered as of this moment, close to a record. As always, today's webinar is being recorded and will be accessible from the CADS website by tomorrow morning. You should have received an email this morning from Pam containing the PowerPoint presentation and one handout. You can also download the PowerPoint directly from the GoToWebinar control panel to the right of your screen. Look for the Handouts tab. Our format is listen only. As always, we do encourage you to submit your questions and comments in the question box in the control panel. We have a packed agenda today, but we will try to get to some of your questions. We continue to be supported with the generosity of the Archstone Foundation, making these now twice monthly webinars possible for all of you. It's hard to believe that it's been 1 year since lockdown, and it is especially gratifying that in the midst of the stress, fear, anxiety, and grief, that you continue to persevere by serving your participants and families. And I think what we've all discovered is a more profoundly deep and personal way, supporting them with visits where they live, in the park, connecting by phone, by Zoom, with doorstep deliveries, and even one-to-one center visits. You've been a lifeline for your participants and families and caregivers over this year. And may I say, you've been the antidote to loneliness. Now we turn our thoughts to spring, and with it, hope for reunification of staff and participants back at the center. As vaccination rates rise and warmer weather allows us to breathe fresh air and do more outdoors, some of us are itching to get back to center life. Others, however, remain guarded and have to get used to the idea of leaving the safety of home after a year of staying put. That is why today will mark the first in a series of webinars designed to help guide you and your participants safely but surely back to center life. Our best thinkers are working with CDA to work out a safe and orderly plan that you can follow. As always, CDA leads and the vision team will help you with ideas on how to operationalize the state's guidance to a safe reunification while continuing to meet your participants where they are when it comes to their own readiness, their endurance, their family situation, and overall how they want their care delivered. We are very excited to begin this journey with you. There was no choice last year but to move quickly and urgently into emergency mode at this very same time. But as we've all learned, as public health professionals have always known, recovery from an emergency takes much longer and is a whole lot more complicated than running into the emergency shelter. So we remain here to support you through October with these web talks. Thanks again for being part of this incredible community and for taking this virtual journey with us over the past year. Next slide. So I think my screen may also be frozen, Renee, so I'm going to assume that the next slide is up on the screen. Our previous web talk featured Dr. Monica Gandhi, Professor of Medicine and Associate Chief, Division of HIV, Infectious Diseases, and Global Medicine at UCSF. Dr. Gandhi has been one of our most popular presenters. You scored it a 4.9 out of 5 points and appreciated the clear, up-to-date science and her practical, humanistic voice that gave us hope for seeing an end to the pandemic, even while we remain vigilant and cautious. Next. We have 3 segments to our web talk today. First, we're very excited to have Dr. Ron Chapman, Michelle Yoon, and Carrie West join us from the California Department of Public Health vaccine team. Dr. Chapman will be providing an overview of where we are with vaccines and vaccination. Richard Lee of our team will then offer an on-the-ground assessment and ideas for you about getting access to vaccines. He volunteers at a vaccination clinic and helps with translation and interpretation. Then we will hear from the ever-popular Denise Peach, retired chief of the CBAS branch at Department of Aging, to help during COVID time. She is on temporary assignment there. And then last, we'll hear from a panel of providers from the Vision team to share their thinking about how to begin making plans for this orderly, safe transition back to center-based services by the end of the year or whenever the public health emergency ends. So thank you, Renee. Our agenda is listed here as I just described. And next slide. We'll take a look at our presenters. We are going to first hear from Dr. Chapman. He is a board-certified family physician who has dedicated his full career to public health and medicine. He came out of a brief retirement to assist in COVID vaccine planning for the California Department of Public Health. It's been an all-hands-on-deck moment, and many answered the call, as did Dr. Chapman. From 2015 to 2020, Dr. Chapman was the Yolo County Health Officer, led the COVID-19 response for the first 6 months of the pandemic. He was also the Director and State Health Officer for the California Department of Public Health. He led the department to its initial national accreditation in 2014. That is a huge accomplishment. He was also the Chief Medical Officer of Partnership Health Plan here in Northern California and served as the Public Health Director and Health Officer for Solano County. Before entering public health practice, Dr. Chapman was on the faculty at UC Davis School of Medicine. So Dr. Chapman, you are the perfect person to join us today to talk vaccines and vaccinations. Thank you and welcome.
Thank you. I appreciate being here. If we could have the next slide, please. So I'll give a brief update on vaccines and all the work we're doing around vaccinations in the California Department of Public Health. Thank you for the invite, and thank you to all of you across California that are serving numerous communities and doing just great work in these incredibly challenging times. Next slide, please. And one more slide. There we go. So this is an update on where we are with the pandemic in California and the most recent number of cases, deaths, and vaccines administered. You're probably all aware that the number of cases and deaths and hospitalizations have been declining dramatically since the awful and tragic surge we had over the winter. And that's all really, really good sign. As you're aware, more and more activities are being approved for reopening throughout California. I just need to emphasize that this is not the case for the rest of the world. There are still many countries that have rates that are going up, countries in Europe that still have large areas that are under lockdown. And so this is a worldwide international event. We are all in this together. You've probably seen the unfortunate pictures and stories, for example, coming out of Miami with the spring break. And we still are at risk because of people's activities. And even when you get vaccinated, you still need to be wearing a mask and social distancing at this point in time in the pandemic. But again, in California, some very promising signs with the data. Next slide, please. The next two slides just emphasize those groups of people who are at increased risk and also show you why we've prioritized certain groups of people, especially initially for vaccines. This shows the risk of COVID infection, hospitalization, and death by age group. I'm sure you're all aware of this, but as we look at increasing age, the risk just increases significantly, especially if you look at the bottom row for death. People who are 50 and older, you can see the 400, 1100, 28, and even 7,900 time increase in the risk of death for people 85 and older. Next slide, please. And there are disparities and inequities with hospitalizations, infection, and death by race, ethnicity as well. And you can see again on the bottom row, the risk of death is 2.4 times greater for American Indian or Alaska Native. It's 2.3 times greater for Hispanic or Latino persons and 1.9 for Black or African Americans. So again, prioritizing some of these groups is critical for our vaccination work moving forward. Next slide, please. And next slide. So if you are eager to keep up to date on vaccine information, I encourage you to go to our vaccineteall58.com website. That's all one word, and 58 is the number 58, so vaccineteall58.com. This is a screenshot from that website of our dashboard that shows over 12,637,197 doses administered. So that is not the number of people that are fully immunized. As you know, several of the vaccines require 2 doses. This is total doses administered. And we have seen a continual increase in the number of doses administered each week since we started this campaign in December. Just recently, I believe we had one day where it was reported over 300,000 people were administered, or 300 doses were administered in one day. So our capacity for vaccinating people continues to increase. In fact, our capacity now to vaccinate people far exceeds the limited supply that we're getting. Next slide, please. So as you know, there are 3 vaccines available. The Pfizer vaccines approved for those 16 years and older, 2 doses given 21 days apart. Moderna is approved for 18 years and older, also 2 days given 28 days apart. And Johnson & Johnson approved for 18 years and older and is only 1 dose. A couple of really important points. First, the number of vaccines we're receiving each week, as I mentioned, is extremely limited. We're getting about 400,000 to 500,000 a week of Pfizer, about 400,000 of Moderna. Johnson & Johnson, when it was approved, we got about 320,000 doses. Unfortunately, in the next week or 2, we will not be receiving Johnson & Johnson because of manufacturing challenges to keep up with worldwide demand. By the end of March, we're expecting somewhere between 4 to 6 million Johnson & Johnson doses nationwide, which translates into somewhere about 400 to 600,000 for California. So in general, each week we receive about 1 million first doses of Pfizer and Moderna combined, and we have many, many, many more people than that we need to vaccinate. And our vaccine capacity at this point is way above that million per week. I think, a couple of other important points. People are asking, if any of these vaccines are better than one or another. And the bottom line is they're all fantastic. So if you have access, you, your loved one, your friends, your colleagues have access to any of these vaccines, you need to get the vaccine if you are eligible. Next slide, please. So who is eligible? At this point, we've been talking about different phases, and we started in December with phase 1A, which is a little over 3 million Californians being healthcare workers and the residents and staff of long-term care facilities. We moved into phase B, which is about 6 million people eligible. These have been food and ag workers, education, childcare, and emergency services. And then we added all people 65 years and older, which is over 6 million people. So you can just do the math in your head. We're looking at about 15 million people potentially eligible just from these 2 categories, phase 1A and 1B. Next slide, please. And then, of course, this week on Monday, we added almost 4.5 million more Californians to be eligible. So now we have about 20 million people eligible, with about 1 to 1.5 million vaccines coming in each week. So not nearly enough supply to meet demand. And it's going to be staying steady state like that for several more weeks. There's talks at the federal level about supply increasing, and our fingers are crossed. You're probably familiar with this. This is for people 16 to 64 years old who have high risk medical conditions. This is all listed on the vaccinateall58.com website. And the medical conditions are listed here: cancer, chronic kidney disease, stage 4 or above, chronic pulmonary disease, oxygen dependent, Down syndrome, solid organ transplant leading to a weakened immune system, pregnancy, sickle cell disease, heart conditions such as heart failure, coronary artery disease, or cardiomyopathies, not including hypertension, severe obesity with a body mass index greater than or equal to 40, and type 2 diabetes with an A1C greater than 7.5%. Next slide, please. We are also vaccinating folks with developmental or other severe disabilities or illness determined by their healthcare providers. The individual is likely to develop severe life-threatening illness or death. Again, all this is described on the vaccinateall58.com website. Or acquiring COVID-19 will limit the individual's ability to receive ongoing care or services, and providing adequate and timely COVID care will be particularly challenging as a result of the individual's disability. Next slide, please. And people in congregate living spaces, such as behavioral health facilities, prisons and jails, people experiencing homelessness who are about to transition into a congregate setting. The state has added public transit workers, including airport workers for commercial airlines, janitors in a variety of settings, utility workers that provide emergency support, such as electricity, gas, water, waste, roads, and highways, and disaster services workers who have been activated, and social workers responding to abuse and neglect of children, elders and dependent adults, and those who must enter a residence as part of their work. Next slide. And that is about the exhaustive list of people eligible for vaccines. Lydia asked me to include this slide, which comes from an announcement from the Department of Social Services, but is based on the CDC recommendation regarding TB testing. So I know you've had some lectures and education on immunology and probably learned some about the body's response to vaccines and all. There is some concern about a potential interaction or effect of the vaccine and TB testing. So the CBC or the CDC recommends that if you're offering TB testing, that you complete the TB test before the COVID-19 vaccination, or if the person's already vaccinated, to defer the TB test until 4 weeks after the completion of the second dose. Or in the case of J&J, it would be 4 weeks after the single dose. I'm sure you've learned that it does take a few weeks for the body's immune response to ramp up in response to the vaccine. And when the body's immune response does ramp up, again, there is some concern that could impact or affect the TB test. Next slide, please. Next slide. So when it comes to addressing vaccine hesitancy, there's a lot of studies showing that people are waiting, and all of those eligibility groups, as they roll out, continue to be eligible. So we're continuing to vaccinate a variety of people in different jobs and work sectors and settings. But it's clear that some people are wanting to wait for a variety of reasons. I've heard from folks saying, I want to wait to see what my friends and colleagues think about the vaccine, how it affects them. And so we've set up a number of structures in the state and ways to try and encourage people to get vaccinated. One, we set up the Scientific Safety Review Work Group. This started as a California work group, and the states of Nevada, Oregon, and Washington were so interested, they joined. and we created a Western States Scientific Safety Review Work Group composed of some of the most prominent international vaccine, public health, academic, medical experts in the world. They have been reviewing all the clinical trial data as the vaccines have gone through the FDA approval at the federal level, and they have given the green light, 2 thumbs up for all 3 vaccines, stating that they have met the highest standards for vaccine safety and efficacy. It is true that these vaccines can cause a sore arm after vaccinations. Sometimes people get some muscle aches and pains and fatigue or even fever, but folks experience these for only a day or two, a few days, and then they're fine. Next slide, please. Our guiding principles for the vaccines have been very clear. We want to be totally transparent with the public, with our stakeholders about the vaccines from the beginning, ensuring that they meet safety requirements and that there is an equitable distribution and administration of the vaccine. And given that these vaccines are very scarce, we've been trying to, again, prioritize groups of people over the last few months. Next slide, please. We are about to launch a huge vaccine campaign. You've probably, hopefully, seen some of the PSAs that have been out, some on YouTube, some through radio, but we're gearing up for the largest vaccine campaign I've seen in my 30 plus years in public health. Really impressive. Our goal is to combat mis and disinformation, and there's unfortunately a lot of that out there when it comes to the COVID vaccine and vaccines in general. We are addressing barriers to access and hesitancy and helping Californians navigate the entire eligibility and appointment process. Next slide. So we're doing that in a variety of different languages. We're going through different ethnic and multicultural media. It's not just social media. Again, it's radio. It's going to be billboards. We're going to be all over California. We've got the live reads airing across 40 ethnic media outlets in 18 languages and have issued over $50 million to over 300 CBOs, community-based organizations, because we want the messages to come from trusted leaders in communities all over California. And so they've been awarded those monies to help get the message out, to counter the dis and misinformation and encourage and educate people about the COVID vaccine. Next slide, please. We're leveraging those trusted messengers we call the ground game by, again, funding these community-based organizations, going through our 61 local health departments, going through state agencies, and a number of key stakeholders. Next slide, please. For folks that are 65 years and older, we're leveraging partnerships with Department of Aging, California Commission on Aging, the Department of Healthcare Services, Social Services, Office of Emergency Services, a number of established groups that serve older Californians all over California. Next slide, please. And next slide. So you probably heard about Blue Shield being involved. The state decided to hire a third-party administrator, which is a group that selects and manages a network responsible for, in this case, delivering vaccine. And Blue Shield was chosen. The state has a contract with Blue Shield, who's going out and meeting with vaccine providers all over the state to develop and manage the state vaccine network. They're involved with the communications and education piece. They're setting criteria for the vaccine administration, and especially with equity measures to make sure that communities that are most vulnerable are getting vaccinated. And they're working on really strengthening the reporting system, much of which is through My Turn, which is the eligibility and appointment online system. Next slide, please. So encourage everybody to go to myturn.ca.gov. This is, again, an online system where you can find out if you're eligible. If you're not eligible, you can, if you wish, voluntarily enter some information to be contacted when you are eligible. System, there is a hotline, and the number is 1-833-422-4255. And through that hotline, there are a lot of language capabilities available. Next slide, please. So how will California get their vaccine? As I mentioned, you can get appointments through MyTurn in some counties. Encourage folks to go through their personal or private healthcare providers as well. You can be checking in on the websites of your local county health department. There are over 600 pharmacies now receiving vaccines through the federal government directly, including CVS, Rite Aid, Walgreens, Albertsons, which Albertsons Corporations includes a lot of pharmacies. So those numbers are increasing weekly and monthly. So access is spreading and capacity is spreading throughout communities. You, of course, can get it through a number of primary care providers. There also are mass vaccination sites in Oakland and Los Angeles, and there are vaccines being administered in some employee or employer-based websites, or I'm sorry, work sites, and through some mobile and pop-up clinics around certain counties. Next slide, please. And that's the end of my presentation. So Lydia, I'm happy to answer any questions if we have time. Thank you.
Yes, we do have time. Thank you, Dr. Chapman. A couple came in. The first one is wondering why diabetes, type 1 diabetes, wasn't included in that list you showed us earlier.
Yeah, that's a great question. So most of that list comes from the CDC. So we adopted the list from CDC. The state had a special work group designed to evaluate eligibility and make recommendations to the governor's office. So we have made some modifications, but for the most part, we've stuck with the CDC website, which only lists type 2 diabetes. On the CDC website, they do have a special note that states that there's not enough scientific evidence for type 1 diabetes to include in this list, but the website does say that there's more scientific research going on, and in the future type 1 diabetes might be added, but for now the scientific evidence, the studies only show type 2 diabetes.
Okay, that makes a lot of sense. But clearly, under the expanded definition, those individuals would qualify. So thank you for that behind-the-scenes look there at how these things get designed. There's another great question about the fewer side effects that are observed among the older population, and what is the reason for that? If that is what we are all experiencing. I know I personally had that experience in my Pfizer vaccine, no side effects.
Yeah. So lucky all of you who have experienced no side effects. And so there are a number of theories, and so most likely it has to do with the strength of the immune response. The evidence shows that the vaccine is highly effective in people, over 65, as well as younger age groups. But it is likely that as you get older, the immune response is not as strong to the vaccine, so you'd be experiencing less side effects. That's the basic theory at this point.
Okay. Another question that's really important, because there's so much misinformation floating around out there about Johnson & Johnson vaccine being one dose and the confusion about efficacy and effectiveness. So could you give us a layperson's understanding of why the J&J vaccine is so great?
Sure. Well, you may or may not know that just in the last few days, some of the top health officials in California received the Johnson and Johnson vaccine. So the Surgeon General of California received Johnson and Johnson. The public health director of the state, Dr. Tomas Aragon, the Surgeon General is Dr. Burke Harris. They both got the Johnson and Johnson, and several other folks received Johnson and Johnson. And it's been aired. It's on YouTube. It's public. They did that to emphasize the point that Johnson Johnson is highly effective. And the bottom line is, if you have access to any of these vaccines, you need to get vaccinated to protect yourselves. The Some of the differences in the vaccines that people haven't talked about is due to the fact that the clinical trials were done at different times. So when they tested Pfizer and Moderna, it was at a different time than when they tested Johnson and Johnson, and they were tested in different geographic areas where there were different viruses that had mutated. So the results aren't exactly apples to apples when you compare these different vaccines, but they all are highly effective and highly recommended.
Okay, thank you for that. Well, I think that brings us to the end of our questions. One quick one before I say goodbye, Dr. Chapman. We've answered this on prior webinars, but it cannot be overstressed. People who have had COVID and survived, what is the recommendation on vaccination, please?
So people who have been infected with COVID, they eventually need to get vaccinated. Some of those recommendations have been evolving over time through the Center for Disease Control, CDC. In general, when somebody initially gets infected with a virus, they have some level of immunity. The issue is that that level of immunity is highly variable. Some people get really sick and have a very high number of viruses in their body, a high viral load. Some people get sick and have a very low number of viruses and maybe have mild symptoms or none. So when a person gets infected, their immune response can be highly variable, which is not the same as when you get vaccinated. You get vaccinated with a standard dose, and people have a standard immune response that gives them immunity. They're immune. But when you get infected, it's not predictable how your immune system is going to be respond. So people who have had the infection, in general, the recommendation has been 90 days after infection to get vaccinated, but I would make sure people are keeping up with the CDC website to make sure that they have accurate information on when to get vaccinated, and of course, talk to your healthcare provider after you've been infected.
Okay, great advice. Thank you, Dr. Chapman. Well, that's our time with you. Thank you again on behalf of all of us for joining us today. You're certainly welcome to stay, but I know you also have other commitments. And I will work with your team to follow up on any questions that we were not unable to get to today.
Thanks, Lydia, and thank you everybody for your great work. Have a good day.
Thank you. All right. So that was a great summary. I want now to introduce Richard, who will provide us with a bird's eye ground view, if you will, of what is going on in Los Angeles County and a couple of other updates. So Richard, thank you very much for putting these slides together for us and speaking to us today.
Sure. Thank you, Lydia, for the introduction, and thank you all for having me again. I'd like to go into just kind of the ground game, as Dr. Chapman mentioned, in terms of operationalizing the vaccinations and kind of the resources. And with the currently added eligibility, I think we wanted to clarify, everybody might have questions of who that takes advantage of CBAS 8HC ADP programs qualifies for the vaccine. And just to put very simply, it is everyone. Everybody that attends CBAS 8HC ADP is qualified for their vaccinations at this point. And you can go ahead and use the link to get the specifics. But in addition to the diagnoses that qualify for vaccinations, there's an or section as well, and it says anybody that has COVID infection or that a COVID infection is likely to result in life-threatening illness or death. Acquiring COVID-19 will limit the individual's ability to receive ongoing services and additional criteria, and anybody that takes advantage of and is part of a CBAS 8H2 program is qualified through that measure. And so I think we wanted to make that very clear. Next slide, please. And this is a sample verification letter from CADS, and this would be similar to, for example, what facilities put out for their staff members when they were trying to evidence status to be eligible. And this by in no means is a requirement. It's not a state requirement, but it can be a local requirement depending on the county that you reside in. Most places where you sign up for an appointment, they'll have their own screening questions and eligibility questions that will allow you to make an appointment. But I would highly suggest that you look at your county websites for specific guidance to see if self-attestation forms or verification letters such as this made on 8H2 letterhead would be applicable as well. Just for specific details for Southern California, Los Angeles County, the public health website actually has a template version of the self-attestation form, so it can be used in conjunction with this as well. For the Central Valley, Fresno County, that self-attestation form is also available on the county website. And we recently learned this morning that Sutter Health, who just resumed taking first dose appointments after their lag starting from February, does not require you to bring a letter, but there's a self-attestation during scheduling. So just by those three examples, very specifically, we can see that it kind of varies. And so we want everybody to have the verification and the self-attestation available so that especially our participants don't have a difficult time once they receive their appointments. I think removing barriers, I think, is the name of the game right now. Next slide, please. And the next two slides are just about kind of parallel what other agencies are doing to kind of mirror what verification letters and kind of the due diligence that's required. We know that regional centers are doing participant outreach for their DDS population and providing on their own letterhead by the regional centers the personalized letters as well. Next slide. And we also know that the Department of Developmental Services are also providing letters. So there will probably be overlap for people that take advantage of both CBAS and regional center programs. But I mean, that's a great thing to have. I think we're worried about not having enough, evidence for people to get eligible. But we know that all our participants qualify. And so this is kind of, icing on the cake that we can kind of use together. Next slide, please. I think we want to emphasize and continue to support vaccination readiness and access. We know that there's a supply issue that Dr. Chapman mentioned as well, and that our capacity is there, but sometimes the supply is definitely kind of the constraining factor. But we still want to make sure that we encourage people, even if they are waiting, and that Lydia has said this many times, but no does not mean never, and that we're trying to really reach a slow yes for those people that are hesitant to receive the vaccines. And so please continue to support your staff and participants with education, gentle encouragement. We found that especially with our staff that are hesitant as well, just general encouragement, positive reinforcement makes all the difference in the world. I think we want to make sure that our CBAS partners and our community partners are continuing to help, because for a lot of our participants, this is going to be the only way that they do receive their vaccinations because of their status. And I think the last point that we want to make is that we need to start as centers keeping track of vaccination status for staff and participants, and make sure that we can filter and focus our efforts on people that have not been vaccinated. And I think as a general rule for reopening later, that this will be a good measure to have. If we have centers that can readily say they have a certain percentage of participants and staff vaccinated, that will be a useful measure to have. Next slide, please. I'd like to also provide a few vaccination clinic sites updates. Dr. Chapman mentioned most of this information, but I just wanted to reiterate that starting March 15th, which was this week, that 4.4 million Californians were additionally added to eligibility, making it harder and more difficult to make appointments. I've tried this myself, but anybody accessing My Turn right now knows that it's incredibly difficult to secure an appointment. And so I think we want to keep abreast of all the information that's out there and different methods. Dr. Chapman also mentioned the Pfizer, Moderna, and Johnson & Johnson, which is also called the Janssen vaccine on vaccine cards. And so I've heard a lot of providers kind of confused over as well, what is Janssen compared to Johnson & Johnson? And it's exactly the same third option that's available right now. We also wanted to highlight that ADA accessibility is improving with the additional inclusion of the eligibility tiers, and sites like Disneyland and Hanson Dam, which are both in Southern California, have added ADA accessible drive-through sites in addition to their walk-up sites. So I think we want to also make sure that we're going to the correct sites that's appropriate for the people that we are sending. And then we also found that Sutter Health in Northern California, they were kind of having problems with the supply, but we just got note that Sutter Health has resumed scheduling first dose appointments for the COVID-19 vaccine in the Sacramento and Central Valley, and that providers announced Tuesday that this would happen. And I believe this is going through directly the Sutter Health website at sutterhealth.org. And so I encourage you to also look at those sites. For the Central Valley, I also learned that for Fresno, the My Turn appointments go online specifically at between 7 and 8 a.m. So I know everybody's kind of feverishly refreshing the site all the time, but not all counties have this information available, but we know that Fresno allows the release of additional spots between 7 and 8 a.m. In the mornings as well. So I think that might be helpful for you to use, but this just highlights that everything is kind of local county specific. And so to check with your county websites for the most up-to-date and relevant information. Next slide, please. With the use of My Turn, which I think we are all using, in conjunction with the added eligibility tiers, we wanted to highlight the fact that this change happened on the website. And so these would be the qualification kind of attestations that we need to complete to have advanced to the next screen of being able to make an appointment. So anybody that is attending CBAS services, very simply on the second screening question would mark yes, because they are receiving CBAS services. They have physical and mental high-risk situations and statuses that allows them to receive the COVID-19 vaccine. And so if you go to My Turn and you go through the screening questions, you can click yes on the first screening question as well, where they ask for these specific diagnoses. But definitely on the second question, we want to mark yes, which will allow you to make appointments for the individuals that previously did not qualify before the 15th. Next slide, please. We also wanted to highlight the additional sites that are available. Everything that's going through My Turn is in and of itself a very useful tool, but like Dr. Chapman mentioned, Rite Aid, CVS, Albertsons, all retail pharmacy websites have a specific separate sign-up link, and they tend to be more local because we all have retail pharmacies around us. And so I would encourage you to go to the different websites and check the availability as well, because sometimes they're not all on My Turn. And so My Turn is a very useful aggregate, but we know that other resources exist. And just kind of expanding further, there are online tools specifically for LA County. There's findmyvaxla.com, which is actually a programmed website that someone made to kind of check whether specific sites have vaccinations or not. For My Turn, we know that we have to enter specific information and then find out if there's spots available. But through this website in Los Angeles, you can see in real time with individual sites what spots are open. And so this kind of exists in multiple forms within Twitter. You know, if you Google kind of COVID vaccine tools, there are a lot that pop up. So please use the one that's specific to you. There are three kind of examples at the bottom as well, just to illustrate the different tools that are available. The one on the left is the Rite Aid scheduler, so they have their own website. The middle one would be for the Find My Vax LA. And then on the right, we have the county-specific and city-specific websites that are kind of blasted through specific local channels for booking as well. So if you reside in a smaller town, I would consider checking the maybe the public Twitter feed or the Instagram page for that county or town as well. Next slide, please. And we know with increasing frequency, there has been partnering with retail pharmacies. We know that we've had a few providers that have had successful runs with CBAS, Albertsons, and Rite Aid with receiving mass vaccinations for their participants. And so I think the first step would be to reach out to your local pharmacies in your neighborhood, speak to the pharmacist, and see if they are hosting on-site clinics for participants and staff. For our center as well, we were considering and in talks with vaccinating 100 of our participants or 50 of our participants. Luckily, we didn't have to go that route, but we know that this exists and that this is available for a lot of people. And so with increasing frequency and this happening, we want to make sure that everybody's taking advantage of this opportunity that might exist in different areas. We definitely don't want people to bank on this and use this as an insurance policy and just wait till the end and then think that they can contact retail pharmacies to make this happen. Again, this is really hit or miss depending on the individual pharmacies. And we found it's much easier to go through individual people and signing them up. But we wanted to highlight that this was also a resource that's available. Next slide, please. And with all this, and with the increasing information that's coming out, we recently found out that the CDC updated their guidance for what vaccinated people can do. And this was for guidance for fully vaccinated people that had passed their 2 weeks after they received their second doses of the Pfizer or Moderna, or 2 weeks after their Johnson & Johnson Janssen vaccine. We wanted to highlight in yellow that this guidance applies to non-healthcare settings and that this was not used for specifically ADHD settings as well. This is just for personal at-home use with this guidance. And so I think this kind of frames what we really want to keep in mind when additional guidance and updates are provided in a very public setting, that we have to abide by the official directives and policies set forth by local and state agencies. And so that's why the information seems conflicting, but it's not conflicting because we have our own rules that we have to follow. And so that was kind of the broad covering of the vaccination kind of ground game that Dr. Chapman mentioned. And I think Lydia would like to take some polls to get a better understanding as well.
Yes, thank you, Richard. Great summary, and we appreciate you continuing to monitor the situation on the ground, as you say. So, Renee, I'm going to ask you to launch our first poll. We have a couple of questions that we'd like to ask everybody. My internet is still lagging a little bit, Renee, so you'll just have to use your judgment here on when you're opening and closing them. So let me know if you have it open.
Poll is open and we are getting responses. 8%, I'll let you know when we get up there.
Okay, good. Yeah, we like to get about, 70% if we can, and I can see the poll now on my screen.
Beautiful.
So what percent of your participants do you estimate are vaccinated as of today? In other words, just at least one dose of a 2-shot vaccine, because we assume if they've gotten one dose that you'll help them get back for their second one, or somebody will help them. So. Okay, what are we up to for percentages, Renee?
Looks like we're about 58 right now, and we're still moving.
Okay. I can hear people calculating their percentages right now. Getting out the calculator.
Yep, we're still moving up in percentages, so it looks like people are still voting.
Okay, we'll leave it open just a moment longer. And then we're just going to check in periodically with you all on these webinars just to kind of keep our own internal measure of how things are proceeding in the field. So thank you for participating in this. Just an estimate. Okay, Renee, where are we? Close to 70?
Yep, we're up to 67% and we've slowed down. So shall I go ahead and close the polls?
Yeah, let's go ahead and move on because we are a few minutes behind our designated schedule because of the delay at the beginning.
All right.
All right. So let's show the results. Should let you do that.
Yep, you guys see it?
I'm not a good judge of that, Renee, because of my internet. So.
Okay, just joking. All right, it looks like the attendees, you guys are viewing the poll results right now. And as we're looking at the poll results, it looks like 38% of you say that about 75 to 100% of your participants have been vaccinated. 32% say between 50 and 75%. 19% of you are saying between 25 and 50, and 9% say less than 25%. And the 1% of you there say that 100% of your participants have been vaccinated.
All right, that's fantastic. Thank you, Renee. That's really good news, especially because the new tiers have just opened up literally on Monday. So fantastic. Keep up the good work, everybody. Very, very proud of you. Let's launch number 2.
All right. Okay, so number 2, here we go. And there we go. What % of your staff do you estimate are vaccinated as of today, meaning they have received at least 1 dose of the 2-shot vaccine? And people are voting. So here we go.
Yeah, everyone probably has this a little more accurately in their minds, so hopefully we can vote a little more quickly on this one.
Yep, we're already up to 56%, so people are voting quicker. And now we're up to 60 almost. It's fantastic. Great results. It looks like the majority of you, over 50% of you at this point, say that between 75 and 100% are vaccinated, but those can change. For those of you that haven't voted, please get your votes in. We're at 65% right now. We appreciate your participation very much. All right, we're at 67, and remember, these are just an estimate, so you don't have to be 100% correct, you know, on your number. Just a good guesstimate.
Okay, Renee. And we do have some people who are not CBAS staff on the call, so I think we can go ahead and close out.
All right, I'm sharing our poll results right now. And about 15% say that 100% of their staff members have been vaccinated, which is amazing. 48% say that between 75 and 100% have been vaccinated. 18% say between 50 and 75% have been vaccinated. 10% say between 25 and 50%, and 8% say that less than 25% have been vaccinated. So this is also fantastic.
Okay, thank you. Thank you, everybody. Number 3, let's do this one quickly, too.
All right. So poll number 3 should be up right now. And the question is, how confident do you feel in your understanding of vaccine benefits and risks?
And the reason that I added this poll, everybody, is because it'll give us a sense of how much more training information that you desire relative to vaccines and vaccinations as we move through the next few months.
All right, so we're up to about 53% right now in voting. And let's take 10 more seconds, guys, gals. All right, so I'm going to close this poll down. We have about 65% voting, and share the results with all of you. And it looks like 76% of you have a high confidence level in understanding the vaccine, accessing resources. 23% say moderate, that they could use more resources in education, and 1% say that they're not comfortable discussing vaccinations.
Wow, that is a huge increase from last time. I'll show you all a comparison real quick at our next webinar. So great job, everybody. You're really excellent students. Okay, Renee, thank you so much. We're now going to move on to Denise Peach, who needs no introduction. Denise is going to give us a little update from where she sits, and then we'll move into our provider panel. Denise, welcome.
Thank you, Lydia, and hello, everyone. Happy to be here today, especially with my Irish kin. A shout out to you, Erin Gobrach, here on St. Patty's. So I'm standing in for Jill today, who's unable to make it. So we have just a couple quick messages today, and eager to hear from the folks who come next to talk about some of the things, elaborate on some of the things that we wanted to share from CDA today. Briefly, we want to cover the last two all center letters that have come out, 2102 and 2103, and then give you a little bit of a preview about what's coming. So next slide, please. So everybody's familiar by now. Richard emphasized it, Dr. Chapman emphasized it. All of your participants are eligible, ADHC and CBAS participants. So that's what we said in all center letter 2103 released last week. And the main takeaways here from our perspective is that we ask for your continued help in providing good, solid information to your participants, assisting as you can to help them with their appointments and getting things done. We also emphasized in this letter that verification documentation from the participants is not supposed to be required, that by virtue of their diagnosis or disability, they are eligible and their participation in the program. However, good points that Richard made about helping participants, especially as they might need assistance in communicating that self-attestation of eligibility. We appreciate providers assisting with that. So that's pretty much all we wanted to share on 2103. I don't want to spend a lot of time there. If we can get the next slide. 2102 came out the week before, March 5th. I think internally we've been sort of referring to this letter as the hang on and be a little bit patient with us. We're going to get some future guidance out here very soon, some guidance on the transition to in-center services that we are planning for right now to take place over this the coming months and through this year. So this 2102, because many people were calling us, providers, wanting to get started right now with congregate services, we wanted to remind everyone that we appreciate your enthusiasm. We are too. We're busy planning, and we want you to get planning for this transition that we anticipate. And so we were emphasizing in this letter that we wanted you to begin planning now and to hang in there. The requirements that we released last year in June under 20-14 all center letter, that those still apply. So that means more specifically, if we can have the next slide, we emphasized that under TAS, the temporary services that you all are providing, in-center services have always been allowed as they can be safely provided, and with a lot of additional detail there in 2014 about how we had advised that. We said specifically group services, basically people congregating and doing things under group modalities, sort of clustered together, was not allowed. And we want to emphasize that again, that until the further guidance is released with regards to a process for this safe and orderly transition to more in-center services and congregate group services, that those are not to be being provided. However, again, emphasizing that individual services can still be provided, just meet the requirements of ACL 2014. If we can have the next slide, please. So those are the two all center letters that have happened so far. The next part of the message is what's coming. So we said in our all center letter 2102 that we were busy laying out the game plan for how we're going to safely and and in an orderly manner, return to in-center services or begin in-center services in group kinds of modalities. And so that is absolutely the message today. We are 24/7 working on getting that guidance together. So the concept in place is going to be a phased transition of all of our ADHD centers and their participants to the congregate services before the public health emergency is expected to end. We're not entirely sure. We think December 31, the entirety of those flexibilities will likely be gone, but that before that, we anticipate that we will be modifying the rules under TASC and transitioning you all back into your center-based services. So we anticipate that TASC will continue to some degree through 2021, but we encourage you all now, as we begin our plan, or now as we continue our planning, that you are looking at a return to your traditional staffing levels, care planning, service delivery, documentation, etc. That's the message today, and I think that's the message of our provider colleagues who are coming on next to talk to us about what they are doing. So all center letter to come. At this point, we have it numbered 2104. We anticipate it sometime in the next couple of weeks. If we can get it out sooner, we will. Part of what we're planning on as we do this is to have the providers complete a revised version of what is now in place, our CDA 7015 form, which specifies requirements providers must meet in order to provide any kind of in-center services. We're modifying that now with a big heavy lift from our ALE CADS vision team. And so we're anticipating that providers will be going through a very, very brief approval process on our part, but what is a pretty significant planning process on your part for demonstrating facility and staffing and program readiness for this transition. So the take homes here are plan now. We want to ensure that we do this in an orderly way. We have a safe return, and that CDA is working with our CADS and ALE colleagues. Will be here to support you through this. So more guidance coming, and I think that's all I had to cover today, unless there are some immediate questions I can address, Lydia.
Great, thank you, Denise. No questions at the moment, so let's move on to our provider panel and we'll see what comes in. We are a few minutes behind schedule, everybody, so if you all can hang in for maybe 5 minutes after 12 today, that would give our panel a little bit of time to share their information. We're going to lead off with Richard for an overview and then move into some key topics that we'd like you to be thinking about. Richard?
Sure. So I'll give if we go to the next slide, I'll give a brief overview of where to start. As Denise just mentioned, that we're planning a return to congregate. We are planning, but what does planning mean? And so these are a few bullet points that are kind of general guidance, but I think generally an example makes sense. If you're trying to make appointments for vaccinations, you can't just log on and make an appointment. You have to log on to your computer, make sure your internet's working, enlist people to help. So these are the kind of strategies we're using when we're thinking about and framing the reopening of centers. It's that prep work that goes beforehand. And we always talk about it being facility prep and also people prep as well. And so this is just the beginning of return to congregate services in center groups. And we're setting up to be able to return to that in a safe manner. As Denise mentioned, we're still within TASC, and even with the lower cases, increased vaccinations, new CDC guidelines, it does not change how we currently operate right now, but it's a window to our near future. So I think we can operationalize a few universal truths and universal things that we can do collectively at centers. I think the reason that we don't have many details right now is that things are kind of constantly changing on a week-by-week, day-by-day basis. So that individual details are really hard to pin down right now, but we're, in a sense, consciously deferring specific details during this interim time period so that we can reach these milestones and set the milestones as we see as safe as safe as we can because of the high-risk population that we have as well. And so the goal is the gradual return to in-center services, and we know that it's going to be this year, but I think if we go to the next slide, we know that the planning can happen in multiple elements, and we broke it down to 3 kind of categories that are easy to conceptualize. It's the facility, the participants, and the staff. With the staff, and our panel is going to go through individual sections, but rehiring, if they're going to work remotely in center, how many you need for a hybrid program. These are all things that we need to think about. The facility, ventilation, how safe it is, do you need to update certain things, and then the participants to see who can come back, how are they going to come back. And finding out how these are all related is a task individually for each individual center, as they are very specific. But we want to provide a little bit of guidance and a little bit of examples in the slides ahead for what I would call the artistic nuance for management to kind of handle as well. And so we want to take out the biggest chunks of preparation as possible so that when the guidance is released in the near future, that we are able to kind of seamlessly transition in. And so we'll move to a few specific slides after this.
Elena, I think you're muted. If you could unmute.
I'm sorry. Thank you, Lydia. Oh, thank you, Pam. Thank you, Richard, for the introduction. My name is Lena Haratunian. I'm going to be talking a little bit about staffing. Like Richard mentioned, we can start planning now. At minimum, we all have the program director, registered nurse, and social worker on the team during tasks. But as we think about and prepare to transition back to center services, we want to start contacting and communicating with the staff members that were part of the core team before COVID. So you've got your activity coordinator, your occupational therapist, physical therapist, pharmacist, the medical director, the LCSW, if you haven't been utilizing these disciplines during tasks. It's a good time to reach out to previous staff members or start searching for new members for staff members for a fresh start while we begin to think about transitioning back into tasks. Also evaluating other disciplines or positions you might need now with new guidances issued in order to continue to make sure that you've got your safety measures in place. For example, supervision and social distancing, making sure participants are wearing masks and staff is wearing masks. So assessing your current staff and what your needs might be as we return back to the center. Another thing that I found helpful when thinking about staffing is allowing your staff members to be part of the process and making sure that they're aware of these transitions. So allowing them to be part of the process, not keeping them in the dark, letting them know so that they have time to mentally prepare that we are slowly starting to get back into the center. And because it's been a year actually that in-center services have closed. So staff also needs time to mentally prepare for that. I want to see if Kay and Richard have anything to add.
Thank you, Lena. So hi, everybody. This is Kay. I just want to reinforce everything that Lena said. Speaking with your staff, maintaining that level of transparency and conversations with your staff about what their needs are and what they think is most beneficial to create to recreate essentially and go back to your roots as a in-center CBAS program for the sake of your participants. And like Richard mentioned, your staffing considerations and how you plan to bring staff back or to bring on new staff necessarily ties in with the needs of your participants and as you evaluate your participants' readiness, as well as the capacities of your facility, what safety protocols and what workspaces are available. So all of these are interconnected and reinforce upon each other.
I think the only thing that I would add on my end is that when we think about staffing, we inherently think about ratios and what's needed from the center's perspective. But I think at this point, we want to flip that and see what the participants need when we're providing services. And so it's not about the specific numbers or the capacity or things that we should be preparing for. It's how can we safely provide services to our participants, because they are the focus of our program. And staffing to that appropriate level needs no number or ratio. And so I think that's just kind of the conceptualization that I've had.
Okay, thank you. Lena's going to remind us about some Cal OSHA standards that we need to be attentive to, and this is related to the handout that you received from Pam this morning that you can also download. So Lena, do you want to walk us through those Cal OSHA real quickly?
I think, Lydia, I'm covering that. Yes.
I think Kay will do a much better job. Take it away, Kay.
Oh, I'm sorry. I apologize, Kay. Yes.
It's okay. I just saw that and I go, oh. So again, everybody, I'll be covering some of the Cal OSHA emergency temporary standards. So these standards have been in place, effective, as you can see on the screen, since November 30th of 2020. And while previously there were no penalties that were imposed on employers, these temporary standards are required for all employers and facilities like ours to put into place a program to ensure the safety of everybody in the building, including your employers, under the occupational safety and health requirements through these standards. And so some of these provisions that have already been in place include identifying hazards that can lead to additional spread or unsafe conditions related to COVID-19, and some of the protocols that should and can be in place to create protections, which include using face coverings and physical distancing. And as you can see on that hyperlink, that gives you additional details and information on what some of the requirements that have been created through these standards. Next slide, please. So in an effort to help employers develop a program that meets all of these requirements, Cal OSHA has developed the Model COVID-19 Prevention Program, and that's been included as part of the handouts for today's webinar. And these requirements that have been enumerated in the program gives all employers some different criteria and different categories where they can go through and evaluate what the needs of their own facilities are, what the needs of their staff and programmatic elements are, so that sufficient protocols can be put into place to meet all of the requirements for safety. And so if you look at the handout, you can see there are different sections and different questions, and you'll see in the text that there are areas where the employer can go through and really just think about what the needs of their particular place of employment are. And then in addition, after using this program, which by no means is required, but I mean the program itself isn't required, but though you are required to fulfill all the requirements under the Cal OSHA temporary standards. So this program is really just helpful to ensure that you are in compliance with those standards. And another important facet is to ensure that all of your employees are oriented to the plan and to document that training, as is kind of commonplace for all of the requirements that CBAS centers are used to doing to ensure that their employees are well trained and well versed in all of the programmatic elements. And so another thing that Lena also highlighted in her staffing piece is to really take in the input of your staff to ensure that their concerns are addressed and that they're part of and included in the planning process, to ensure that everybody can go through this transition period of going back to a semblance of normalcy once hopefully, knock on wood, all of this is behind us. Next slide, please. So this is just an example slide from the model plan that we've outlined through this slide deck, which I'm sure you all could look at your leisure. And it just looks at some of the engineering controls parts of the model plan. So just for example, some of the measures that can be implemented in situations when you can't maintain that physical distancing of 6 feet between individuals. All centers are directed to look at what their own capacities are, what their own building layouts are, and see if there's any site-specific measures which can be put in place. For example, maybe partitions can be put into place in instances where physical distancing just isn't a possibility. The second piece is air filtration, whether there can be natural or mechanical filtration and ventilation that can be put into place. And again, this guidance is meant to be used as a way to help you determine what your building can allow for. Everybody's facility, everybody's center is different and unique, and that's part of the strength of our program. But in that sense, you have to be kind of creative and evaluate your own conditions and your own facility to make sure that all of the safety protocols that are in place, not just to maintain compliance with the Cal OSHA requirements, but also to ensure that your participants are in the safest place possible as they begin to come in to receive in-center services as we transition back to traditional CBAS. Next slide, please. And again, this slide just demonstrates some of the additional guidance that has been made available through Cal OSHA, especially with regards to ventilation, which, as we know, because COVID-19 is an airborne virus that travels through droplets, ventilation is really an important part of ensuring that your facility is safe for your staff and participants. And so please, take the time to go through the Cal OSHA website and this interim guidance especially to get a better sense of what are some ways and methods and tools that you can use to improve the ventilation and the filtration and the air quality of your facility. Okay, so next slide. Now Lena will be taking the lead again for helpful tips and our facility preparedness.
Thank you, Kay. Thank you for that wonderful information and explaining all of that to us. As we prepare to come back to the center, we should assess our facility. Make sure we are aware of CDC guidelines, LA County Public Health guidelines for reopening facilities, and making sure that our facilities are ready to bring back participants. And I think it's mentioned before, especially for those facilities that were not being used for the past year, really need to go through maintenance to make sure that everything is ready. But this would be a great time if you are looking to do any cosmetic fixes for your center, whether it's painting, redoing the floors, or making space for staff to make sure that you are complying with social distancing guidelines. Now, at the time when we eventually do go back to center, the guidelines may have changed. Who knows? At this moment, the 6 feet distancing continues to stay, along with wearing masks, whether individuals have been vaccinated or not. And so we must, as we prepare, we have to go along with when the guidances are issued. You want to make sure you have your HVAC systems and filtrations checked before participants are starting to come in. Also making sure you have enough supplies, PPE, ready to go for a certain amount of, specific amount of time. You want to make sure that you have hand sanitizers and the furniture, the tables that your participants will be sitting at are social distancing, and hand sanitizers are readily accessible for participants and staff. Okay, Richard, did you want to add anything?
I think you covered everything.
Yeah, I agree. I think the only note, again, as a program director, I'm looking for just tell me what to do. Just give me like the specific number that we need. But we don't have those, and for good reason, because things are constantly changing that like we talked about. So putting our best effort into making these changes, because we know these changes are going to occur, is the best first step, I think. And I think all program directors and owners know their facilities best and the changes that are needed to accommodate the situation.
Yeah, and just to add,
go ahead.
Sorry, Lena, just to add, these elements and these factors are meant to really be looked at holistically. We know, and we all experience different difficulties with our facilities and what our facilities we can do and we cannot do based on any particular limitations. And so it's more of just looking at everything as a sum total. Maybe there's some things that you can do with regards to filtration and ventilation and HEPA that you may not be able to, that some other facilities may not be able to do just because of the way their layouts are. So if you look at all of these different factors and try to improve one even more so in order to compensate for something that you can't do on another end, is always a helpful hint, I think, that can help.
And just a last note, I can't emphasize the importance of including staff when preparing the facility, again, because you want to make sure that your staff has enough time to mentally prepare and also be comfortable for going back to that group setting. COVID took everyone by surprise and people continue to be anxious about it. So you want to have your staff's input. You want to ask them, are you comfortable with our setup? Is there something more that we could have done that we have overlooked? So including your staff in this process, I have found has been very effective. That way I can make sure that when we do come back to the center, I'm not going to have staff tell me that they're worried, they're nervous, and can't come into work. With that, I think I want to pass this on to Jennifer to talk about participants.
So Lena, I think you have a couple of slides though to show about your facility, right?
Yes, actually I do. Thank you, Lydia. This is a picture of what our center used to look like before COVID. And excuse the little boxes in the front, but you can see that the tables were pretty close apart. There's probably about 8 to 10 chairs at a table, but we took the time where the in-center services had stopped, and we did a really quick remodel. So next slide, please. We went ahead and added 2 windows in the back to bring in more light. We have socially distanced all of the tables. At the moment, you will see 4 chairs to a table, but in order to comply for CDC guidelines, there will only be 2 chairs at a table when participants do start coming back to the center. We decided to get brand new chairs, brand new table covers, refinish the floors, paint the walls, add those 2 windows. And the reason for these changes, not only for sanitation and safety purposes, but also it's more inviting, it's exciting. Staff was very excited to see these changes, and participants are excited and can't wait to see the changes. It's just it's a fresh start, and that's the approach that we took.
Okay, so now I think it's Jennifer's turn.
Good morning. I don't think my camera's on now that I'm here. Let me see. There we go. Okay, I'm just going to keep talking. Oh, there I am. Okay. Well, good morning and happy St. Patrick's Day to everybody. I had wanted to talk about this topic because I feel very strongly about some things we can do to get participants ready. I'd like to propose a thought for you to think about. What if you were planning a party and no one showed up? How would that make you feel? So I think in answering that question, we need to talk about participant readiness. And we can look at participant readiness on 2 tracks. One is what we as a center and staff are doing to help participants get ready. And we can talk a little bit about that in terms of is there transportation eligibility in place after a year? Perhaps some of their parent transit eligibility might not be there. There might be issues with their IHSS hours. There could be a whole host of things that we as staff can help facilitate to help them get ready to return to the center. But I think more important, what I want to talk about this morning is taking a very person-centered approach to checking in with each participant and their caregiver to ask them what do they need to do, or what needs to happen for them to feel ready to come back to the center. Because I think what's happened over this last year is when we have our phone conversations with our participants, they're saying, oh, I can't wait to get back to the center. When is the center opening up?
and they are verbally telling us they're excited to get back to the center. But what do we have to do for them to walk the talk, is what I want to call it, because I think we're going to see some stumbling blocks where people are saying they want to come to the center, but them actually moving forward and being ready to come to the center might be a different story. So I think if we take a, like I said, a person-centered approach to that, we can learn from them what needs to happen for them to be ready. Some of the things that we need to talk to them about is what their expectations are in terms of what the center will look like when they come back. I had a phone call yesterday from a caregiver, and they asked me, oh, you're not going to open the center and there's going to be, 65 people there. So what that's telling me is some people are very concerned about safety of their family members and how we are going to handle infectious control at the center. So I think what would be really helpful is for our staff to talk about a plan of safety and infectious control that we want to share with family members, and that we're all saying the same things. Because sometimes a nurse might say one thing and a social worker might say another. So we want to sit down as a group and talk about what our plan is and how we want to communicate that to the family. I think other things that we need to ask participants about is, do they see any barriers to coming back to the center? One of the things I was thinking about is some of my folks who don't have family support have been out for a year, and what is their clothing and shoe situation like? We might take that for granted. Maybe they're going to feel uncomfortable coming to the center if they're not properly dressed or don't have the clothes that they feel they need to come to the center. The other thing that we need to address with the participants and start talking to them about is what healthy routines are they doing at home? Maybe ask them, when you were coming to the center, what time did you get up in the morning? And what time are you getting up now? And there might be a disconnect for that. So we might want to start helping them to get back into some good healthy routines so that they can come back to the center. Every situation is going to be different, and your participants the best, So you just need to have these conversations with them and let them share with you what some of their concerns are, what maybe some of their fears are, in coming back to the center and helping them through those. So I think those conversations are going to be really, really key to getting our participants back. And I know we're running really short on time, so I just want to bring in Lena and Kay to ask if you'd like to add something to what we're talking about this morning.
Yeah, just really, really briefly, wonderful points, Jennifer. In addition to all of that additional information that you'll need to be gauging in the next weeks and months as we prepare to return to traditional CBAS, is to also use all of the information that you've gathered in the past year, those weekly assessments and COVID screenings and ongoing case management, doorstep deliveries, every bit of information that you've gained from your participants as you've continued to provide services to help them through the pandemic is incredibly valuable. And so all of this new information can build upon some of the trends and issues that you've seen and helped solve over the past year.
Great.
And I just want to reemphasize using the group approach when assessing the participants' readiness to come back to the center. So utilizing the core staff that were the main point of contact during tasks, along with the program director and the caregiver and the participant when thinking about coming back to the center. I've found truly that including everyone in different aspects of coming back to the center has shown positive outcomes. And I really just want to emphasize the team effort.
Right, thank you. And I also will say we might have a little bit of the luck of the Irish, because as we're bringing people back in, the weather's going to be improving, hopefully. So that'll be one thing that they might not be able to say, I can't come back because it's raining or it's too cold. So hopefully the weather's going to be nice throughout the state of California as we move forward with our plans. Next page. Next. Okay, thank you.
Jennifer, Lena, Kay, Richard, Renee, am I leaving anyone out? Thank you, everyone. Thank you, Vision Team. Thank you, Department of Aging, Denise Peach, for joining us today, and all of you. So you can see here, hopefully, the calendar. We have transitioned to our new schedule of the first and third Wednesday of the month, unless we need more. And we'll be coordinating with the Department of Aging, as always, for future trainings that they may be conducting, and coordinate that with these web talks. So more to come. There's not a lot of detail because we're going to plan these webinar topics as needed in a logical progression. So count on us for that, everybody. And next slide, I'll end with my thought for the week and let you all go to enjoy your St. Patrick's Day. A river cuts through rock, not because of its power, but because of its persistence. So James Watkins is an American motivational writer. He wrote a book called Squeezing Good Out of Bad, and it has to do with lemons. And that may be his most famous quote of all, this one here. It's not the brute strength of pushing and pulling things around when we think about strength, but the gentle strength that comes from dogged persistence. And I want to thank Jennifer for sharing this with us, our CADS president and member of our vision team. I imagine, as I see this and I read this, that the deep channel of discovery that you all have carved for yourselves, your family, your center team, participants, caregivers through this COVID era has changed the entire landscape of your experience and left it deeper and richer, stronger. So thank you for joining us, everyone. Keep up the good work on vaccination. Stay well, mask up, make those plans, and we will see you on April 5th. Thanks, everybody, for hanging in there with us today.